Good. Why don't we get started for today's virtual education session? The role of nutrition in Parkinson's disease. My name is Bill Paget, and I'm the Regional Executive Director for the American Parkinson's Disease Association. There are a couple of housekeeping things that I'd like to go through first. And so if you could forward to the next slide, that would be great. The APDA has been in operation for decades and offers programs and services to the PD community in Massachusetts and surrounding states. We've received a very large response for today's presentation. As you may know, there's been tremendous progress in understanding and treating Parkinson's disease. PD is highly individualized from person to person. Not all that is discussed today is relevant to everyone. The healthcare team must be familiar with the signs and symptoms of Parkinson's disease, as well as learning to treat PD. Treating PD requires a team approach to be treated well. And today we are providing information, and this information is not intended as medical advice. I'd like to now just talk a little bit about today's webinar. It's a webinar, so there's no interaction with the audience. If you have a question during today's presentation, put it into the Q&A button, and we'll try and get to as many questions at the very end as we possibly can. I want to introduce today's presenters. Today's program is presented by two individuals. The first is Stacey Zawacki. Stacey is the director of the Boston University Sargent Choice Nutrition Center and a clinical assistant professor in health sciences department at BU's College of Health and Rehabilitation Sciences. Sargent College is part of that. Additionally, she is a licensed registered dietitian nutritionist, RDN, with a master's degree in exercise science from Sargent College and a doctoral degree in public health from BU's School of Public Health. Dr. Zawacki founded the SCNC and the Sargent Choice Healthy Food and Education Program in 2004. The second presenter is Rachel Reynolds, MS, RDN, LDN, and the Assistant Director of the Sargent Choice Nutrition Center. Rachel Reynolds is a licensed registered dietitian nutritionist with a master's degree in nutrition from Boston University. Rachel joined the Sargent Choice Nutrition Center team as a clinician in 2013 and transitioned to a hybrid role as the assistant director and senior nutritionist in 2018. This is a very important topic to the PD community, and we're very happy to have both Stacey and Rachel presenting today. And so without further ado, I'd like to transition today's presentation to Stacey and Rachel. Thank you.
Thanks so much, Bill. Hi, everyone. My name is Rachel Reynolds. My colleague Stacey Zawacki and I are honored to be here with you today to talk about the role of nutrition in Parkinson's disease and living well every day. I'll begin today with a discussion of the role of nutrition in Parkinson's. I'll first review nutrition goals and then address common nutrition challenges for people living with PD. My colleague Stacey Zawacki will share important themes common to a range of beneficial eating patterns, including the MIND diet, along with the steps involved in evaluating dietary supplements. Nutrition plays an important role in health promotion and the management of many chronic diseases, and Parkinson's disease is one of them. It's no exception. Adequate and balanced nutrition supports overall health, energy balance, strength, digestion, and bone health. A registered dietitian nutritionist, or RDN, can support people with PD by helping them add foods that support their overall health, as well as establishing routines, planning meals, and modifying recipes to manage non-motor symptoms of PD, medication interactions, and medication side effects. Nutrition goals for people with PD include adequate calories for a healthy body weight. Body weight changes are common in PD. People often experience weight loss prior to clinical diagnosis, followed by an increase in body weight during early treatment. As Parkinson's disease progresses, unplanned weight loss is associated with increased energy expenditure due to both involuntary muscle movement and excessive muscle tone. A balance of macronutrients, macro meaning those big nutrients that provide calories, is important because of their varying effects on stomach emptying time and the bioavailability of levodopa. The three macronutrients are carbohydrate, protein, and fat. A variety of foods from each food group is recommended to ensure adequate micronutrients, micro meaning the small nutrients that don't provide us calories, but they do provide us with essential nutrients like vitamins and minerals and protective substances like antioxidants and phyto or plant chemicals. And then lastly, some of the common nutrition challenges in PD include constipation, appetite changes, unplanned weight loss, delayed gastric emptying, and medication interactions, which often present challenges for people with Parkinson's. So the goal of nutrition therapy is to counteract these nutrition challenges with targeted dietary changes. Okay, so the first macronutrient that we're going to talk about today is carbohydrates. The primary role of carbohydrate is energy for activity. And in addition, the brain is normally totally dependent on carbohydrate. Foods and beverages that are mostly carbohydrate have the fastest stomach emptying time compared to foods that are higher in protein or fat. This is helpful for people to understand if they're experiencing delayed stomach emptying time. Because we digest carbohydrates quickly, they provide us with immediate energy, and they don't keep us full for more than about 1 to 2 hours. The food sources of carbohydrates that are listed here include starches like breads, rice, pasta, and potatoes, as well as beans, peas, and lentils, which contain mostly carbohydrate, but they do have small amounts of protein as well. Fruits are 100% carbohydrate, while non-starchy vegetables contain a balance of both carbohydrate and protein. You will see fiber and added sugars listed separately on food labels under total carbohydrate. So often when people hear the word carbohydrate, they often think of primarily starches and grains. But as you saw in the previous slide, there are many other sources of carbohydrates. We are going to just focus on those grain foods that come up quite often in terms of sources of carbohydrate. We're going to focus on them for just a second here. When we do talk about grain foods, you'll often hear the terms whole grain and refined grain. A whole grain is a grain that exists with all three of its original parts. So you can see them pictured here, the bran, the germ, and the endosperm in the same proportions as it would have had when it was naturally growing in the ground. Each of the parts contains a unique set of nutrients, and altogether it makes whole grains a good source of fiber, heart-healthy oils, B vitamins, and other essential vitamins and minerals. These nutrients, as well as the phytochemicals found in all plant foods, make whole grains such as whole wheat, oats, brown rice, quinoa, popcorn, you can see there's a few other listed here, and this is not an exhaustive list, are beneficial for digestion, for brain health, and for cardiovascular health. The next macronutrient we're going to talk about today is protein. Protein is the building block of all of our cells and is essential for muscle maintenance and repair. Protein, as you may have noticed in your own life, gets a lot of hype. A lot of hype in the media, and sometimes it seems like it might be the most important nutrient just because of how much it's talked about in the media. While it is essential to eat adequate protein, most people get more than they need because there are many food sources of protein that people don't think of. So that includes things like grains and vegetables that we just talked about on the previous slide. And also because often our portion sizes of protein foods are quite generous. It's helpful to note that protein is more satiating than carbohydrate or fat. So often it's recommended that to help people manage hunger when they're dieting. But for people with PD, where a lack of appetite can be a common issue, increased protein is not necessarily a helpful goal for people with PD. There are both animal sources and plant sources of protein. Plant proteins have a higher carbohydrate to protein ratio. So replacing animal protein sources with plant protein sources can be helpful in adjusting overall protein intake, which I'll talk about a little bit more in this next section coming up. People with Parkinson's disease who take levodopa, a common therapy for Parkinson's disease, have additional considerations with dietary protein. Dietary protein competes with levodopa for absorption and transport through the blood-brain barrier. A 2021 review of dietary approaches to optimize levodopa therapy highlighted that high amounts of protein can interact with levodopa therapy and can lead to unpredictable motor fluctuations and higher levodopa dosage requirements. Often people may describe feeling that their medication is not working as well, or it's wearing off before they expect it to, or before their next dose. In general, it's recommended for people to take levodopa about 30 to 60 minutes before or 1 to 2 hours after eating to optimize the absorption of the medication. Some people report nausea when they take levodopa on an empty stomach. So people may also find that a small carbohydrate only snack at the time of the medication, that can be appropriate as well. For individuals with moderate motor fluctuations, it can be helpful to substitute plant sources of protein for animal sources and to spread them evenly throughout the day because of the higher carbohydrate to protein ratio that we discussed previously. And as an added bonus, plant protein sources also contain fiber, which can help improve constipation symptoms. And constipation is a common symptom of PD and also a potential side effect of the higher levodopa dosages. For individuals who have marked motor fluctuations, it can be helpful to limit protein during the day and aim to meet the majority of the daily protein requirements at the evening meal. That pattern is called a protein redistribution diet. A registered dietitian can help with meal planning, which may include a protein redistribution diet if that's appropriate to ensure that someone is meeting their total protein requirements. The third macronutrient that we're going to discuss today is dietary fats. Fat is a major source of energy, and it aids in the absorption of fat-soluble vitamins that we have listed here. So vitamins A, D, E, and K. It's recommended to focus on heart-healthy sources of fat, like olive oil, canola oil, peanut oil, nuts and seeds, nut butters, avocados, olives, and fish. Fat prolongs stomach emptying time. It takes longer to digest. So high-fat meals can exacerbate delayed stomach emptying, which is also a common symptom of PD. And a registered dietitian can help someone to spread their fat intake evenly over the course of the day. Okay, so now we're moving on to micronutrients. When dietary intake of nutrients from food is compared to recommended levels, almost all Americans fall short. In particular, with the vitamins listed here, A, C, E, and D, with the minerals listed here, potassium, calcium, and magnesium, as well as dietary fiber. These are all nutrients of concern for most adults with or without PD. This is because most Americans don't eat recommended amounts of health-promoting fruits, vegetables, whole grains, fish, beans, and milk or dairy alternative products that provide these essential nutrients. For people with PD, folate, vitamin B12, and vitamin B6 are additional nutrients of concern. So with that in mind, the slide here listed some common food sources of the nutrients that we just discussed on the previous slide, aside from vitamin D, which we're going to talk about a little bit later in the presentation. You might notice a theme here. So as you're looking at some of these common sources that are listed under each of these different micronutrients, I've highlighted in red everything except for the fish and the sardines, because most of the foods listed here are plant foods. Plants make substances that we can't make, so it's essential that we eat them. In addition to vitamins, minerals, and fiber, plants contain neuroprotective substances, antioxidants, and beneficial phytochemicals. Most people could also benefit from eating more fish as well. So we're going to shift gears a little bit now. So we've kind of talked about, some of the goals for nutrition in Parkinson's disease, and now we're going to talk about some of the more specific nutrition challenges in Parkinson's disease and provide some kind of general recommendations and considerations around these common challenges. The first challenge we're going to talk about today is bone health. Bone health is a concern for people with PD. Adequate calcium and vitamin D are essential for bone health. Many of the calcium sources you see listed here overlap with the foods that we've actually mentioned earlier, and I've mentioned in the presentation already. It includes some specific sources of those plant proteins. So that would include tofu, beans and legumes, and almonds, as well as specifically dark green leafy vegetables in the non-starchy vegetable category. Enriched rice milk and almond milk are lower in protein and are typically fortified with comparable amounts of calcium and vitamin D that would be found in cow's milk. Vitamin D is challenging. There's limited food sources of vitamin D, and most people are not exposed to adequate sunlight to make it in the skin either because the light is not direct enough for many months of the year. Certainly that's true for all of us up here in Boston and in the Northeast, or also because we may also not be able to make it adequately because if we're wearing protective clothing or sunscreen, that would impact our body's ability to make it as well. It's recommended that you have your vitamin D levels tested to determine if therapeutic vitamin D supplements are indicated for you. The next challenge we're going to talk about is actually the most common GI symptom reported by people with Parkinson's disease. That's constipation. Nerve damage reduces muscle contraction needed to move food through our digestive system, and medications can also play a role in constipation. Many people with PD are aware of the general recommendations to increase fiber and fluid intake. The role of the registered dietitian is to help tailor recommendations to fit a person's unique lifestyle, schedule, preferences, financial considerations, etc. For example, I often support people with identifying opportunities to add fruits, vegetables, whole grains and beans, as well as fluid to their existing routines. People might add berries to their breakfast, swap whole grain bread in for refined grain bread on their sandwich, or add a cup of water when they wake up in the morning. Incremental additions like this provide time for the body to adjust to the increased fiber intake and also add up over time to improve constipation. The recommendations for dietary fiber range from roughly 25 to 35 grams per day and vary depending on total energy requirements for each person, with men typically needing higher amounts than women. The average American adult consumes 15 grams of fiber per day, and so in comparison to the recommendations, we can see increasing fiber intake is beneficial for most people, both with and without PD. Recent studies have also examined the relationship between the gut microbiome and constipation, in particular, the potential role of probiotics. Probiotics are beneficial bacteria that live in our gut and have health-promoting effects. Some foods, such as fermented milk products like yogurt and kefir, have been shown to improve constipation symptoms along with adequate fluid intake throughout the day. The fiber in many of the foods I've mentioned earlier provide what's called prebiotics, which provide fuel for beneficial bacteria and can improve constipation in their own right. Researchers are examining the role of probiotic supplements in constipation in people with PD and improving the gut microbiome in people with PD. While there is some preliminary evidence that probiotic supplements may be beneficial, there are still many questions about the type and amount of bacteria, the duration of treatment, and the reliability of these probiotic supplement products. Later in today's presentation, Stacey will be spending some time providing additional considerations for evaluating dietary supplements in general. As mentioned previously, body weight changes in Parkinson's disease are common. Unplanned weight loss can be the result of many factors that impact patients with PD. And some of those primary challenges include decreased desire to eat due to fatigue, reduced appetite, or changes in smell or taste, difficulty swallowing, discomfort or bloating related to constipation or slowed stomach emptying, increased physical activity, both voluntary and involuntary, which increase our overall energy needs. The general recommendations to help people avoid additional weight loss or to promote weight gain include eating frequent, smaller meals throughout the day to avoid excessive fullness, choosing soft, moist foods that are easier to chew and swallow, and alternating small bites of food with sips of liquid. For individuals with difficulty swallowing, a speech therapist can help identify the appropriate consistency to eat for safety and for ease of swallowing. And then a registered dietitian can help you implement these recommendations with modifying the foods that you eat based on all those unique characteristics we discussed before for each person. Small adjustments are often effective and can be accomplished with these changes. If you're considering a nutrition supplement, you'll notice that a lot of the products on the market are designed for consumers looking for extra protein, as protein gets all the hype we were talking about earlier. This is not a goal for people with PD, so the low protein, high calorie supplements designed for people with chronic kidney disease would contain a better carbohydrate to protein ratio. And sometimes in implementing these changes, a dietitian can also be helpful with understanding what the whole picture looks like for an individual in front of them. Often trying to fit in frequent smaller meals can be really challenging for people depending on what their schedule is and also depending on what their medication regimen is. So that's something that would be considered and a registered dietitian could help someone with. So I'm going to pass it over to my colleague, Stacey Zawacki, and then we will chat again at the end.
Thank you, Rachel. Hi, everybody. So I'm Stacey. Rachel just shared some really helpful information about the range of foods that help us meet our nutrition requirements. But for most of the last century and even continuing to today, we focused on nutrients and were less specific about foods. That is because nutrients like vitamins and minerals helped us prevent and treat acute deficiency diseases that were more common at the beginning of the century. For example, we were successful in preventing rickets by adding vitamin D to milk. And so when chronic diseases like heart disease and diabetes started to become more prevalent, the same approach was used. Only this time, the recommendation was to limit specific nutrients. Food companies responded with new products that were low in fat, you might remember those, but made with refined grains and added sugars. That led to confusion about the healthfulness of carbohydrate. And then products that are high in protein but low in carbohydrate found their way into the marketplace. Today, researchers recognize that focusing on dietary patterns of food is a better approach to chronic disease, including Parkinson's disease. Why? Because foods are more complex than the individual nutrients they contain. For example, the plant sources of carbohydrate, protein, and fat that Rachel emphasized contain a nutrient matrix of multiple nutrients, as well as other substances that work in synergy to nourish and protect us. It can be challenging to separate the benefits of eating a recommended food from the benefits of not eating a less healthful food in its place. And that is called substitution effect. And it's captured by looking at the pattern of food that we eat. So eating, well, I'm actually going to talk about that on the next slide. One of the dietary patterns that is well studied is the Western dietary pattern. It is characterized by high intake of red and processed meats, solid fats like butter or margarine, sweetened beverages like soda or energy drinks or even coffee drinks with syrups, desserts and snacks, refined grains that are missing the complete package of protective substances Rachel mentioned when describing the benefits of whole grains, as well as fried foods and salty snacks. As Rachel emphasized, this dietary pattern is low in nutrients of concern that she listed in detail on a slide, including dietary fiber. It is associated with chronic inflammation, and I know some of you are interested in inflammation. I can already see questions in the chat. An unhealthy gut microbiome, and increased risk of many chronic diseases. For people with Parkinson's disease, it can exacerbate the symptoms of constipation, delayed stomach emptying, and affect the amount and frequency of levodopa that may be needed. In contrast, beneficial dietary patterns are characterized by the foods Rachel helps people with PD incorporate into their meals and snacks. In addition to their high nutrient content, including the dietary fiber I just mentioned, these dietary patterns provide prebiotic fuel for a healthy gut microbiome, anti-inflammatory omega-3 fatty acids, as well as protective antioxidants and plant chemicals. These foods are featured in a range of beneficial dietary patterns described in the latest edition of the Dietary Guidelines for Americans, including the DASH diet, which is something that you may have heard of. It stands for Dietary Approaches to Stop Hypertension, and also healthful Mediterranean and vegetarian style eating patterns from around the world. The Mediterranean DASH diet patterns I just mentioned have been studied for their effects on a variety of risk factors for chronic diseases like blood pressure, cholesterol, and inflammatory markers, as well as health conditions like cardiovascular and neurodegenerative diseases. You may have heard of the MIND diet. It stands for Mediterranean DASH intervention for neurodegenerative delay. It's a hybrid of both the Mediterranean and DASH diet patterns, and it emphasizes neuroprotective foods like leafy greens, berries, nuts, and extra virgin olive oil to capture the anti-inflammatory and antioxidant nutrients associated with brain health. The MIND diet also recommends limiting the foods common in the Western dietary pattern. And that is the substitution effect I just talked about. So some of the benefits come from eating these very protective foods, and some of the benefits come because you're not eating some of the foods that are more pro-inflammatory. You may hear more about this diet in the years to come as studies are being published. This is an area, there's currently a 3-year clinical trial going on that's looking at the MIND diet and Alzheimer's disease risk. And they're actually giving participants their berries, so a half a cup of berries 5 days a week, an ounce or a handful of nuts or peanut butter for 5 days a week, and then 2 tablespoons of olive oil per day for the duration of that 3-year study to make it easier for people to comply with the diet and so they can test its effects. In the meantime, there are many good reasons to incorporate these recommended foods in your own dietary pattern. In a past webinar, I mentioned that a multivitamin and mineral supplement is generally recommended, but is not a substitute for healthy eating. And I think Rachel made that point very clear. This type of supplement includes essential nutrients, so it can be helpful if someone is deficient in a certain nutrient or to prevent deficiency, but it does not include the complete package of co-nutrients and other protective substances found in recommended foods. Choose one that is age and sex appropriate to account for varying nutrient needs. Vitamin deficiencies like vitamin D or vitamin B12 may require therapeutic doses of those vitamins and should be confirmed first by blood tests and treated under medical supervision. You may see supplements, including herbal supplements or all natural supplements, that claim to help with certain health conditions, including Parkinson's disease, or make promises like brain or memory support or increased energy. I want to take a few minutes to explain why these are not generally recommended. The regulations that govern dietary supplements were signed into law nearly 40 years ago. At that time, most of the products marketed as dietary supplements were vitamins and minerals intended to supplement the diet. When the law was written, dietary supplements were defined as a subset of food, and unlike drugs, which require strict testing for safety and effectiveness before being approved for use, food is presumed to be safe in the first place. As you will see on the next slide, the marketplace looks very different today. Today, only 22% of consumers use dietary supplements to supplement their diet. The remainder use dietary supplements to improve their health, prevent disease, and address a variety of health issues. Millions of people report using dietary supplements instead of over-the-counter medications, and some even report using them instead of prescription drugs. Regulations have not kept pace with the changing marketplace, and this has big consequences for consumers using dietary supplements to address health concerns. Unlike drugs, the FDA does not have the authority, with the laws as they're currently written, to approve dietary supplement safety, effectiveness, or labeling before products are sold to the public. The FDA does not even have a complete record of all the dietary supplement products on the market because manufacturers don't have to notify the FDA. Dietary supplement companies are the ones responsible for ensuring products meet regulations for safety and quality, and some consider that a conflict of interest. To protect consumers, the FDA must rely on aftermarket surveillance and reports by companies, healthcare providers, and consumers to identify and address unsafe products. So some of us don't, even if we have a problem, we might not recognize that there's a problem, or we might not report it because we don't know how, or we might not speak to our healthcare providers about it. And so the FDA does not have a complete picture of some of the problems that need to be addressed. And in addition, the FDA does not have the resources to deal with the explosion of products on the market that can cause harm. A few years ago, when I was teaching a class on dietary supplements, the city of Boston had a bigger budget for snow removal than the FDA had for monitoring dietary supplements. And it's a multi-billion-dollar industry. So that really needs to change. To make things even more challenging, companies are allowed to use something called structure and function claims to market their products. You have probably seen structure and function claims on the labels of food and dietary supplement products. They describe the effect of dietary components of the product on the normal structure or function of the body. They don't describe the capacity of the product to treat a disease or condition. In fact, there are strict rules that are meant to prevent claims from suggesting a value in treating a specific disease. But research shows that consumers interpret claims like supports some type of health as providing protection from the same type of disease. I've given you some examples on this slide. One of them is helps maintain a healthy immune system. So that follows the rules because it's not saying helps shorten the duration of the common cold or helps protect you from the flu. But many consumers, when they see a claim like this, they would interpret it as meaning, oh, I should take this during cold and flu season. Or supporting brain health might keep me from, having some type of, problem with cognition before as I'm getting older. And so these can be very misleading to consumers. And the evidence that supports their efficacy in treating a disease or condition does not have to be there for them to be used. So no dietary supplement has been proven to slow the progression of Parkinson's disease at this time. But researchers are hard at work evaluating the safety and effectiveness of dietary supplements that may be helpful for a variety of conditions, including Parkinson's disease. Advocates are also hard at work lobbying for updated dietary supplement regulations to protect consumers. For now, let your healthcare team know about dietary supplements you're considering taking. If a supplement contains an active ingredient that actually works, it is likely that it will interact with other supplements or medicines that are being taken. This information is not on the supplement label, but it can lead to adverse effects. And so these are considerations that we think when we're taking a drug, we are told about potential side effects. We're told about potential interactions. We have to go to a pharmacist and, they ask us if we have any questions. Dietary supplements may be sold in those same stores, but what you see on the package is what you get. And part of that just goes back to the types of products that are on the store shelves now just differ so much from the types of products that the current regulations were designed to help. The current regulations are really designed to give consumers access to supplements that they might need, and not to have them wait for long randomized controlled trials and lengthy approval process by the FDA. But at the same time, that can mean that there are risks that consumers don't know about. So Rachel, are you back here?
Yes.
There you are.
I'm back.
So we were talking before this webinar started, and Rachel, I'm interested, what kind of take-home messages do you hope that the participants in today's webinar will take away from their time with us?
Yeah, thank you. And thank you all for listening. We've provided a lot of information. And when I was thinking about really what the take-home messages would be, I was thinking that, first and foremost, eating more of these health promoting foods that we've talked about during, today's webinar are beneficial and for everyone. And so that's the same, they're beneficial for people with Parkinson's disease as well. And in addition, some of those same changes that are in line with some of these sort of general health promoting eating pattern recommendations have additional benefits for people with Parkinson's disease because they can help to either improve certain symptoms or side effects of medication, or they can help to support maintain strength. They can help people support maintaining a healthy weight and preventing unplanned weight loss. They can help with sort of general digestion. So there's really sort of a lot of added benefit for doing some of those same things or kind of working towards some of those same recommendations that would be beneficial for everyone. And in addition to that, thinking about some of the specific nutrition challenges for people with Parkinson's disease that we spoke about today, it can feel like, okay, there's 3 or 4 or 5 or different unique challenges that maybe someone is up against, and they're kind of trying to figure out, how do I support myself and how do I make myself feel better with these particular challenges. A lot of times the recommendations actually align between some of these different challenges. So it's not necessarily, if someone is experiencing, 3 or 4 symptoms or side effects that they might have to do 3 or 4 different things. Often we can kind of find ways for the recommendations for those unique challenges to align with each other. And so some of those things that stand out to me, when we're thinking about some of the non-motor symptoms of Parkinson's disease, like constipation or delayed gastric emptying, a lot of those recommendations align, where we're trying to choose foods that have fiber. We're trying to kind of spread meals evenly over the course of the day, having smaller, more frequent meals, making sure that people are having adequate fluid intake and are hydrated throughout the day. And so even though those are 2 separate challenges, a lot of times, those recommendations can align there. And then the last thing I'll say is, as I mentioned a few times in my piece of the presentation today, is that there are a lot of things that a registered dietitian can do to support patients with Parkinson's disease. We're not always the first person to be referred to on the healthcare team. And there's a lot of other, great people on the healthcare team as well. And I wish everyone could work with a dietitian to help them customize a plan that can be adjusted, as their condition changes over time. See, those are my main take-home messages.
Oh, those are great. And I took away those things listening to you, Rachel. So I hope everybody else did too. So when I think about take-home messages for today, a couple things come to mind for me. So with dietary supplements, what I wanted to do was emphasize why you might hear your healthcare team say, be careful when, if you're thinking about taking a dietary supplement, or please let us know about any dietary supplements that you're currently taking. And that is because a lot of the information that your healthcare team has access to isn't available on the label of the products that you're taking, or might not be even disclosed by the manufacturer, because the rules are really written for a different type of product. But your healthcare teams, Rachel and I use a natural medicines database that is subscribed to at Boston University, that takes the research as it comes in and really evaluates the quality of the research, and then gives us information about safety, about effectiveness, about interactions. And so if you share that information with your healthcare team, you can work together to understand why you think it would be helpful, and then they can look at your unique situation. What other supplements are you taking? What medications are you taking? What is your, what symptoms are you experiencing? So I really encourage you to share that information with your team. And then another take-home message that I hope everybody takes away is you do hear that theme: more research is needed, and we don't have all the answers. And that is true. And this is an active area of research, and new papers are published every day. But what that doesn't mean is that we don't already have enough confidence in what is known to be able to recommend changes that will be beneficial today. And so, we know, looking at dietary patterns, that, the foods that Rachel described today have so many benefits, and that each individual change is beneficial in its own right. And then, being able to incrementally make additional changes can really lead people to the health outcomes that they are they're hoping for. So we hope that you will do that. We'll come away with that optimistic message. There's a lot of things that we can't control, but nutrition is a real area of opportunity where we can take good care of ourselves, and dietitians can help. So thank you so much, everyone, for being here with us today. And I guess we're going to probably move along to the Q&A period.
We are. Thank you very much, Rachel and Stacey. Fantastic presentation today. What I'd like to do is work through a few questions. And before we do that, I just want to make a general statement. As Stacey and Rachel have indicated, this is a very important part of building a healthcare team. This is one area that we get a lot of questions about, and this presentation was incredibly valuable to our PD community. From a general standpoint, we've gotten some questions regarding the slides. What we're going to do is, we've recorded today's session, which includes the slide set. We'll be distributing that. We'll also have it up on our YouTube page. And so the slides will be embedded in today's presentation. Secondly, we've gotten a lot of questions about referrals. If you're in Massachusetts, reach out to the Information and Referral Center at BU Medical Center, and we'll try and find a good nutritionist for you in the community that you live in. If you're outside of Massachusetts, either reach out to your local chapter or the national organization, and hopefully we'll be able to connect you with somebody in your community. I'm going to start with the questions, and we've gotten quite a few. I don't think we're going to be able to get through all of them. I'm going to try and make them as general as possible. There certainly are some very specific questions that are probably going to be better answered, directly with a RD or a nutritionist down the line. And so the first question that I have is, you spoke a bit about inflammation. Please explain inflammation, and does turmeric help with reducing inflammation in your experience?
Rachel, Do you want me to take that one?
Yeah.
Okay. So I'm so glad you talked about inflammation. And turmeric is considered sort of an anti-inflammatory. And actually, I was just teaching this in class yesterday, and it's part of, just like we said, nutrition matrix. It is part of a matrix of many other anti-inflammatory foods and spices and herbs that that have shown to have or to contain anti-inflammatory properties. And so that is why you have heard of it. When it comes to taking a supplement, some of the questions and the reason, that is that there's not standardization necessarily on the research around the right dose or the way to, or confidence that we can have about the sort of the quality of what's in the bottle, and the potency depending on how it's handled, and so that's where taking that's part of the reason why different studies show different results. And so if you are considering taking something like that, again, please share that along with everything else that you are taking with your healthcare team, and they can look at what the dose of what you have compared to what the research has studied. But in the meantime, using turmeric in your cooking to make foods taste good, and not, what we're learning, and that's why I wanted to focus on dietary patterns today, is there's no single magic bullet, but really it's getting the benefits of the recommended foods. And many of the foods that we mentioned today are also anti-inflammatory. And then also when you're eating an anti-inflammatory food, you're unlikely to be eating a pro-inflammatory food. So I hope that helps.
Yes, thank you. The next question I have is, does protein redistribution contribute to constipation?
I can take that one. So I would say in general, so if we think about protein foods and we, like we discussed, there are animal protein sources and then there are plant protein sources. If initially with protein redistribution, we're working on, moving or potentially substituting those animal sources of protein, and then we may also be working toward, with a full protein redistribution diet, we may also be moving those plant sources of protein later in the day as well. So the foods that would remain, so the foods that are carbohydrate foods, so things that are whole grains and our fruits and our vegetables, which may have little bits of protein, but not large significant amounts, those foods are going to be good sources of fiber, which are something that's going to be beneficial and helpful for improving constipation symptoms. And those are things that we can still spread evenly throughout the day. So anecdotally, in my experience working with patients and doing a protein redistribution diet, it didn't have negative impacts, on their constipation or on their digestion. Potentially, even for some people, it could be helpful if it helps them actually get higher fiber foods earlier in the day or more of them throughout the day.
Perfect. Thank you.
Anything to add to that?
Yeah, there's just a big difference if animal sources of protein, especially meats, are very concentrated in protein. So a 3 ounce, which is just a little hand size of a chicken or a beef, is going to give over 20 grams of protein. And often we serve those meats in portions of 5, 6, 7, 8 ounces. So it could be 50 or 60 grams of protein in one serving of meat. Whereas the vegetarian sources of protein, like nuts and beans, are going to be closer to 4, 5, 6, 7, 8 grams of protein in a serving. So you can see they're much lower, and at the same time they're going to contain that beneficial fiber, and so that can, those, including those, like Rachel said, can help with both constipation and with that protein levodopa interaction.
Thank you. Next question we have is, will dairy products interfere with the absorption and efficacy of levodopa?
So I can certainly start with this one. So dairy products that are from cow's milk, so like regular dairy products is what we might call them. So if it's milk, yogurt, cheese, those are all animal sources of protein, and so those are do have the potential to interact with levodopa because of the protein content that's in those dairy products. There has been a lot of other research that's sort of in its preliminary stages around dairy and Parkinson's disease, and at this point, it's really sort of in its infancy, and it's an area for future research to better understand what the role of dairy is in either risk of developing Parkinson's disease or progression of the disease.
Right, and fermented dairy products, like the kefir and the yogurt that Rachel mentioned, may actually, be helpful for the microbiome and for other things that are of concern that can make a difference in Parkinson's disease progression. So, again, no single good or bad food, but the whole pattern of getting more of what's recommended, and that can make it easier to have the moderate amounts of the other things that might interfere.
Thank you. The next question we have, is there something intrinsic about PD that can cause weight loss in some individuals, or is it more related to simply eating less due to difficulties in swallowing, upset stomach, etc.?
Yeah, I can go, because I can start with this one. Yeah, so there's a couple of things that would potentially play a role around the unplanned weight loss. I mean, some of that being, some of the components of Parkinson's disease would actually increase our energy expenditure. So we have sometimes our energy expenditure might be increased from voluntary movement or increasing physical activity if someone is working with physical therapy, or they're increasing physical activity as part of their treatment. But in addition to that, Parkinson's disease also, has involuntary movement and excessive muscle tone that are part of Parkinson's disease. So that would play a role in increasing energy needs, which potentially plays a role in unplanned weight loss, as well as all those other components that you mentioned. I'm forgetting exactly which ones you mentioned, but certainly the changes in appetite and, and smell and taste, the either nausea or the slow gastric emptying, which can make people feel quite full, which can make it challenging to eat as much. And then in general, movement concerns or mobility concerns even, which might impact meal preparation or might impact chewing or eating foods or preparing foods that people are typically eating. Stacey, I'm not sure if there's something you'd add to
Yeah,
that.
I mean, I think that says it all. That's why this is so common, because there's so many contributors. The good news is that often, you can see weight loss when you're off 100, 200 calories on a regular basis. And so, we don't always have to make big adjustments to counter that. And there are many ways that Rachel mentioned today that could be helpful in just, sort of making up that difference. And then also, Bill pointed out how important it is to have a team of providers. But, if it is difficult to prepare food, or if it takes more time to eat food, or more time, to get food to your mouth, there are tools and, that our colleagues in occupational therapy can help with as well. So, I hope that gives you hope that there's help in your team.
Thank you. Next question we have is, when my stomach is upset, examples bloated, indigestion, diarrhea, and constipation, my levodopa almost always is much less effective and my symptoms are typically much worse. What can I do to help improve the absorption and/or calm down my stomach when this occurs? And what can I do to decrease the likelihood that this will occur in the future?
Yeah, it's a good question. I mean, there's going to be a lot of things about each individual person and sort of how they experience, on the one hand, what you're describing of these digestive symptoms and how they might how they might be a part of your life, how frequently, if you find that they happen after certain foods, if you find that they happen at certain times of day, and as well as kind of how you notice your medication working or not working how you expect. So there's a lot of components of this that are going to be really highly individualized. But what I can say, is for let's say, for example, for constipation, if someone is digesting things slower, that can impact the absorption of levodopa. And so where we might start is with thinking about, what are the ways that we may be able to, use food and maybe think about fluid as well to try to improve those symptoms. But I hear you, there's other symptoms too, right? So your stomach might feel upset, or you might also be experiencing diarrhea. So what I would be interested in learning more about is how you experience that, and if we could kind of identify any patterns around that to help to support those symptoms, which then, overall would hopefully help to support the absorption of the medication.
Yeah, and we work on a team of actually 10 dietitians in our center, and different members of our team have different sort of specialty areas, and we have a dietitian who deals with all issues gastrointestinal, and so just because someone has Parkinson's disease doesn't mean that they don't also have an allergy or an intolerance or something else that could be at play, or that their medications could be adjusted and get improvement that way. So we would work as part of a complete team, and we would all talk together with you at the center of that team to try to really understand what's the, what is the root cause of those symptoms, and is there something that we don't want to miss that could be part of, helping you feel better.
Good, thank you. I have one more question and then we'll end the session for today. Thank you very much. So the last question is the visit with a registered dietitian covered by insurance different for Medicare Advantage plans versus regular Part B?
Stacey, I can take this one if you want. So it is complicated. Unfortunately, Parkinson's disease is typically not a covered, nutrition is typically not a covered benefit for the diagnosis of Parkinson's disease. Certainly different insurance companies will have, different diagnoses that they will cover, or different ways that people may be able to get support from a registered dietitian. Often people also have other things going on that may be covered under their insurance plan that's not necessarily the diagnosis of Parkinson's, but it could be a related symptom or something else that they have going on. So I always hesitate to say yes or no to this question, because on the one hand, it depends on the insurance company and the plan that someone has for what's covered. That's just so highly individual, but also with whatever that person has going on. Because if Parkinson's disease as a diagnosis is not something where nutrition is a covered benefit, there may be another symptom or another diagnosis that potentially could allow someone to have their visits covered by insurance.
Yes, and are you doing virtual appointments at your center?
Yep, we are for people who are located in Massachusetts. Yep.
Great. So thank you very much, Rachel and Stacey. Fantastic presentation, valuable information. If you could move to the next slide and we'll close out today's presentation. Thank you. So again, the APDA located here in Massachusetts has an information and referral center at BU Medical Campus. Phone number 617-638-8466. We can help you with referrals and resources. We do education and support. We have support groups in the community. We also provide health and wellness. Next slide, please. Make sure that you connect with us on social media, Twitter, Facebook, Instagram, as well as visit our website, apdama.org. We very much appreciate both Rachel and Stacey doing today's valuable presentation. Again, this will be available on YouTube. We'll be distributing today's presentation to everybody that registered and participated. We thank you so much for attending today, and we look forward to seeing you again down the road. Thanks and have a great day.
Thank you, everybody.
Thank you.
Thanks, everyone.